Hi viewers, welcome to my channel. Uh, 6 months have passed when I started this journey of posting lectures on YouTube. All my lectures have been appreciated by you, loved, and affection has been shown by you. It has emboldened me to continue this journey. Today I am going to share my experiences with graphites. This medicine was first proved by the great master Dr. Hahnemann himself. He has listed it as a great antisoric medicine in his chronic diseases. This is a polycrest medicine, covers a wide range of symptoms, and miasmatically, though it has been antisoric prominently, however, it has a lot many shades of syphilis and psychosis. So, in other words, it can be said to be trimiasmatic medicine. My first encounter with graphites happened almost 15 years back. That is in my memory, which had given me a splendid result. A old man about 65 years old came to me with his chronic wound that was on his feet. The color of the foot was black, leg was black, and the area upon which the wound was present was even more black. The wound was oozing out liquid that was very viscid in texture, and its color was golden yellow. The discharge was sticking on his leg. There were cracks on the wound, and that was enough for me to come to the prescription. I didn't ask any question further to that person, only by observation the medicine was indicated, and it was graphites. Graphites in this case worked splendidly, and within a few weeks the whole wound that had been suffering uh, to that person for a long time disappeared. So in this case you see that how how the wound was presenting itself. There were cracks, there were darkening of skin, there were discharges, sticky discharges. So sticky discharges and darkening of skin was psychotic, while the cracks were syphilitic, and there was itching also that was soric. So in this case there were trimiasmatic presentation, and graphites covered all the three, and single-handedly the case was cured. So this is the power of graphites. Hahnemann has categorized it as a very deep acting medicine. Another case, I remember of a girl who is 18 years old, and he came to me for the treatment of darkening of his skin that was increasing. The darkening of skin was on her neck, left neck, and it had extended to the shoulder and even downwards to the left arm. It had extended in the back also. So there was patchy presentation. of the skin. It was remarkably different in color from the rest of the body. So long it was under the cover of the dress, she didn't care for the treatment, but as it was now coming out of the dress, as it was coming over the neck and it was coming even beyond the arm, down the arm, beyond her sleeves, it was now visible, and that's why she was very anxious and disturbed about the increasing trouble. She was unmarried, and she had been suffering from leukorrhea. The leukorrhea had a characteristic to occur a few days before the menses. The menses were usually very delayed. She had menses since 13 years of age, but it was usually delayed menses, coming almost 10 to 14 days late. There were cracks on the sole. Another remarkable thing that I noticed in this case was the perspiration. She had very profuse perspiration on her palm and soles, and very peculiarly it was present even in winter. By writing, when she writes or when she makes a fold of the hand, fold of the make a fist, it was perspiring, and there was perspiration also in the classroom if any teacher asked her to answer any question. She said that she gets afraid of what would happen if she answers wrong. She didn't go to nearby shop even, and she wanted someone to be along with her all the way to the shop and house. So there were many fears in that girl. The girl was lean, though not very lean. She was lean, and her muscles were very lax. There was no tonicity in her muscle. So this was all that I noticed in this case. Here two things are very important. The lady was full of fear, and she had cracks in the sole, and the color of the skin had discolored. It was black, and it was left sided. Leukorrhea before menses, few days before menses, delayed menses, all these are very characteristics of Graphites. Graphites is made of carbon, and carbon has a lot of fear. Carbon has not too many experiences of the real world, and that's why carbon has a lot of anticipatory fear. What would happen next? And carbon wants to make a name of fame of herself, want to make an identity of herself. But the real issue is what would happen next. That is the main concern of carbon, because the carbon organism of carbon has not gained experience in this world. He has not faced the challenges of the world. So this is, in this case, the presentation, the pathological presentation was of graphitis, left sided, over the soldier, discoloration, blackening, and menses delayed. Graphitis worked beautifully in this case, and one day after treatment of few months, all her patches which were increasing ceased to increase, and the darkening faded away, and she was very happy. Her cracks were removed, and menses became normal and on time. Leukorrhea ceased, but the perspiration was still continuing. So one day I noticed that the perspiration started on the tip of the finger. This was very peculiar, that the tip of the finger became moist first, and on this basis I prescribed her sulfur, and thereafter the case was closed, that as sulfur worked splendidly well, her perspiration also reduced now. So this way Graphites worked very well in that girl. I am sharing my third case. This case is of 30 years old lady. She had delivered second baby, and soon after delivery she complained of hemorrhoids that was left sided. The hemorrhoid was very painful. After the stool, there was a lot of burning, and the burning lasts for long hours. The hemorrhoid was so sensitive that she could not sit with legs closed, and she preferred to lie with legs apart. The touch was very sensitive. On this basis, muriatic acid was prescribed. She had said that the problem had happened to him because she was subjected to a lot of medications, particularly antibiotic, after the delivery for 15 to 20 days to make the wound heal. The child was under cesarean section, so there were medicines for healing the wound. But as a side effect of this, she developed the hemorrhoid. She had been suffering from constipation for a long time, for which she had taken treatment earlier also. But off and on the problem was with her. So after muriatic acid, she got a lot of relief, but the problem was not over. The constipation was still continuing. So at this time I inquired the case thoroughly, and I found that there was a history of suppression. She had eruption almost 20 years back, for which she had taken allopathic medicine, and thereafter the skin eruption had disappeared, and since then she had been suffering from constipation. Another peculiar thing that I noticed in that lady was that she had a lot of flatulence, distended abdomen sensation, particularly during the menses. So these two things are very important: the history of suppression and how the metastasis followed from the skin to the gastrointestinal region, and that created constipation. And second thing, during the menses, the aggravation of flatulence. These two combinations brought to me the idea for Graphites. And thereafter I inquired her mentals and found that the lady was very ambitious. She uh, she belongs to a rich family, but still she wanted to study and to become something, so that she could earn a name and fame for herself. So this is also a great characteristic of Graphites, and that Graphites are very ambitious persons. So overall the lady was a fit case for Graphites, and I prescribed Graphites, and over a period of time of 3 to 4 months the whole constipation was over, and she had a normal appetite, normal uh, motion of the stool. In another case uh, that I am sharing with you is the case of a girl who is 20 years old, and he had been suffering from eczema of the hand, and the eczema was on the right hand. It had and there was a lot of spots, scars, spots of the wound present on that lady. The lady said that the whenever she scratches, it creates a scar there, or if any wound happens, that scar remains for long time. It doesn't go away. The eczema was very itching. It was it was over the back of the hand and in the and between the fingers. It had started almost 4 years ago. She had some issue with her mother. She felt that she was neglected by mother, and this has created a lot of anger in her. The anger was suppressed, and this suppression of emotion was the basic cause for the eczema to erupt. Along with that, she had her nails very brittle and deformed. She is also a very ambitious girl, and uh, her motions are now regular, but a bit constipation is the usual phenomena with that girl. The suppressed emotion with the combination of factor that eczema, particularly between the fingers, voluptuous itching, moisture after scratching, and nails, deformity of nails, the scar presentation after the wound were some of the features which were indicative for this medicine along with other medicines. But two things were but another important feature that I got in this case was the leukorrhea before menses and the delayed menses. Usually she had delayed menses. The menses were very scanty, and sometimes they were so of menses. She had the feeling that menses would about to come, but it was not coming. Many times she had pain in the abdomen, lower abdomen. Sometimes she had pain in the back. On this basis, Graphites was selected, and Graphites worked beautifully. The menses which had stopped reappeared. The skin lesions improved a lot. Her skin was completely free in few months of treatment, and there was a lot of improvement. Now this case was not completely cured by graphitis. There were a number of other medicines taken in the follow-up that completed the case. But for the time being, when the menses were delayed and the skin lesion was present, these two factors were completely cured by this medicine. In another case that I am going to share with you is is about a girl of 13 years old, and the girl came to me for the treatment of delayed menses, but on the same day she suffers from caraja also. There were discharges from the nose. At the same time she felt that the nose is stuffed, and there was pain all over the body. The fever was not at that time, and the mm, the parents said that she catches cold very easily, and almost every weeks, very frequently, from the slight exposure to cold, she gets uh, running noses. There are sneezing, violent sneezing, running noses, and cough also happen if the caraja persists for a few days. The menses appear usually late, almost 15 to 20 days late, and this is the feature ever since she has been experiencing the menses. I selected a medicine for the lady which she was about to take from the next day, but in the same evening uh, the girl went into fever, and the parent contacted me that she is running in fever of 101 degree Fahrenheit, and the pain was all over the body. When I asked, she said that she is feeling pain in the ear, in the teeth, and the whole of the body was painful. The throat was very, very painful. She felt that as if there is something in the throat, and the throat was um, she wanted to get it clear up. The eyes was not that much painful, but particularly the ear, teeth, and throat were very, very painful. In this case, I uh, got one important thing, that the girl had been under some gonorrheal type of discharge some few years back, for she had taken treatment, and after that the girl had otorrhea for which she had taken treatment, and ever since she had been under uh, the affection of cough and cold, recurrent cough and cold, recurrent caraja, chronic caraja. So this is very, very remarkable. So dear friends, when you have a history of suppression, you should never ignore it. And many a times what we go by symptoms alone, but many a times symptoms alone are not enough. If you want to cure a case permanently, you have to go to the root of the case, and only then you can cure a case. Hahnemann in organon from 205 to 209 has described very beautifully. He has said that attack at the root cause, and he had found, after his strenuous effort of almost 15 years, 15 to 20 years, three fundamental causes that he named soda, syphilis, and psychosis. And he said that if you attack at the root, all the ancillary branches will automatically fall down. So whenever we see the symptoms are only the presentation, various presentation of the morbid phenomena of the disease. So if you don't understand the disease and if you go on the branches only and we try to cut it off, the new branches come up again and again from many places, and we get confused with the jungle of the symptoms, and the patient doesn't get cured. So it is very very important to understand the real cause of the disease, and if you attack upon that cause, the whole morbid phenomena vanishes like anything. So this is the beauty of homeopathy, and we every homeopath should understand this. If you want to be successful in homeopathy and if you want to give a permanent relief, that is the ideal of honeyman, that the patient should be cured permanently. We have to understand the complete morbid phenomena since beginning, and that's why honeyman in aphorism number 5 has said to understand a case completely from various point, and he said in 5 and 6 to 5 and 6 of organon to take note in the particularly in the chronic cases the complete history of the disease. Every standpoint, every turning point in the history of the disease has to be noticed. In the chronic cases, this is very very important, and if you take notice of it, you can understand the complete picture of the morbid phenomena, and upon that if you prescribe, your success is guaranteed. So in this case which I am telling, that the case of the girl who thou came with the delayed menses for the problem of delayed menses, had been suffering from recurrent caraija. On that day she went into fever, very acute fever, and so first in this case, my approach was two pronged. First I have to tackle this acute presentation of fever, and thereafter I have to tackle the chronic caraija and the main problem of the girl, that was of delayed menses. I have to tackle this in the phased manner. So first of all I took care of fever, and in this fever the remarkable thing was the pain. The pain was all over the body, though it was very very remarkably felt in the teeth and in the ear. Pain in the teeth during fever is very very peculiar. Very few medicines are there in this group of symptom, in this symptom, and Graphites is one important medicine here. And the overall presentation of the girl is also of Graphites. See how there is recurrent caraija, recurrent sneezing, recurrent catching of cough and cold is very very remarkable in Graphites. Graphites is a chilly person. Graphites catches cold very easily, and one important aspect of Graphites is that in the caraija there is running noses. With that running nose there is a stuffiness, and there is sneezing. This looks like nux vomica, but you have to understand this from the viewpoint of the other uh, uh, concurrent symptoms. The other symptoms were of delayed menses. The menses were delayed, and there was a history of suppression. So in this case I found that the lady was constitutionally also of Graphites, and for the acute also she had the presentation of the Graphites. So in this case Graphites 30 was prescribed, and the Graphites 30 the same day as it has appeared in the evening. The same day the fever subsided by night, and from the very next day the fever was over, and the pain in the throat was still there, but in next day, from within 2 days, all these carousal symptom and pain symptoms was over. She had been under my treatment for delayed menses still, as the case is of very recent time, and I do hope that she would got cured with Graphites alone. Uh, and if needed, mm, to give supplements of Graphites, that I would see in future. But see how Graphites worked in this case. So dear friends, in all these cases which I have presented here, Graphites work very beautifully. So some important features of Graphites I would like to share with you from all these cases, that Graphites has remarkable affinity to skin, and as well as the gastrointestinal region upon the mucous membrane. It has a strong influence of the respiratory tract mucus, and has a strong influence equally on the alimentary tract mucus. It is and it is a great medicine for suppressions. Anywhere if there is suppression, and after that suppression, um, the problem of gastrointestinal region has started. Among many medicines, one may think of Graphites first. Graphites is a wonderful remedy here. So that's all for today. I hope that this lecture you would have enjoyed, and if you have liked it, do do comment, and do share, and subscribe to my channel. Uh, Best wishes to all of you. Thank you very much for watching me.